Well, you certainly do want your eyesight to be in great shape to see the leaves this fall.
That's right. News 13's Victoria Dunkel joins us live this morning from Asheville Eye Associates off Sweeten Creek Road. What conditions are people seeing at a growing rate, Victoria?
Well, it's a specific group of people who are seeing a certain condition. Baby boomers, as we know, are getting into those golden years more and more each day, and that is actually leading to an increase in the number of trips to the doctor for cataract treatment. Dr. Damien Macaluso is with Asheville Eye Associates, and he is the guy who helps people see clearly. You specialize in corneal health and cataract removal, and I understand you're seeing a lot more patients these days.
That's common. This is a very common problem that baby boomers have, and we know we're seeing more and more baby boomers now. So approximately 3 million cataract surgeries are performed each year here in the United States, and it's growing every year.
What's a cataract?
That's a great question. So a cataract is a natural clouding of the lens, and the lens does 1/3 of the focusing power. So this is a model of the eye, and the lens actually sits right here, right behind the iris. So when you look through the eye, you'll see the little pupil in the middle, and right behind that is where the lens is. And it should be clear like this right here. And what I tell my patients is that your lens is no longer clear. It kind of looks more like a chocolate M&M, and they seem to be able to understand that. And as a result, the image that gets focused on the back of the eye is no longer clear, and they can't see. So for most patients, they have an otherwise healthy eye. They can't see. It's no fault of their own, other than they're having birthdays. And we can help them out with this very great, very safe procedure now.
And let's talk about this, because this is a fast procedure. You said roughly how long?
Usually about 7 to 10 minutes for most routine cases.
And what are you pulling off in those 7 to 10 minutes?
So we actually remove the cataracts. So the technology that we use is called phacoemulsification or ultrasound, and it's really been evolving over the last 25 years. It's computer driven, so just like computers in the 80s were kind of like took the size of a room, but now we have a smartphone. We've got a very strong computer in here that helps us remove a cataract with this very fine tip right here. And this is what removes the actual lens itself. It's a little hollow tip, and it vibrates about 15,000 times a second, a very small amount, and it aspirates that cataract out through the little hole right there, called phacoemulsification.
Once that's gone, you gotta put something back, don't you?
That's correct. So the lens does 1/3 of the focusing power for the eye. So we put in a lens implant, or an artificial lens. It's man-made, and these are made of various materials. Now, they're not actually this size. This is to help you see here a little bit. But this is the optic that helps focus the light, and these little arms here are called the haptics. And there's different types of lens implants that we put in. I tell the patients the lens implant has really got a lifetime guarantee. It doesn't go bad, unlike some other replacement parts that people put in for patients. And there's even some advanced technologies for lens implants now, like this one called the Technis multifocal, that lets patients see far and clear and near without glasses, so they can actually get a more full range of vision and become less dependent on glasses. And this is actually a little model of the lens implant right here, actual lens implant itself.
Oh, it's so small.
It's about the size of a dime, a little bit smaller than that. And you can see the optic there and the haptics that we implant into the eye. And once it's in there, it stays in there forever and never goes bad and gives them very clear vision.
How quickly are they going to notice the change?
That's great. So the way we anesthetize the patient now is with some IV sedation and typically just numbing drops or a gel around the eye, so we don't have to do any injections. So usually the patient can start to see right after the surgery. We put a clear shield over their eye so they can see. And most patients start to recover some vision that night, but most patients get 90–95% improvement overnight with this.
All right, so we're hearing all of this. We know that cataracts are part of growing older. Who needs to be checking in with their doctor to make sure they're tracking this?
That's great. So most adults should have a dilated eye exam at the age of 40, and then check up periodically from then on until about the age 60. But really, 60% of people in their 60s and 70% of people in their 70s have the symptoms of cataract, which are simply the vision not being as clear or sharp, needing more light to read, having trouble driving at night. These are some of the early symptoms that become attributed to a cataract.
So you get your regular checkups, you work with your doctor, you spend a few minutes with you, and vision is looking good.
It's a wonderful thing to do because we can give people back the vision they've been missing and get them back to their lifestyle, their activities very quickly with minimal inconvenience.
Just another great reason to make sure that you take advantage of the opportunity to have regular eye exams. We've been showcasing the reasons that kids need them, the reasons that certain growing populations need them. It's just a good idea to get in touch with your eye doctor. I want to thank the folks at Asheville Eye Associates for letting us in early this morning. In Asheville, Victoria Dunkel, News 13.